I think first and foremost, one that many families aren't familiar with is an orthopedic impairment specialist. That is a service provider that should always be written into the IEP for any student who qualifies under orthopedic impairment, whether they're just on a consult collab model or if they're coming out and providing more direct support. Um, Once a student qualifies as orthopedically impaired, then that provider should be there for the annual meetings and, of course, for the triennial meetings at minimum. And their role is really to support, again, accessibility across all areas. So, I think oftentimes people may view it as very similar to a PT, a physical therapist, but their role is a bit more vast in that, again, they're looking at accessibility not just motorically for like ambulating across campus, but within the classroom and accessibility to curriculum, what, tools and services and supports might that student need. So an OI specialist is very important. And they're a great, resource to have on the team. Students might qualify for physical therapy. And again, the PT's role within the school setting is more looking at that bigger realm of accessibility, if you will, as far as ambulating the campus. They may qualify for occupational therapy, which they're looking at kind of that smaller scope in terms of accessibility to the smaller muscles. So if a student requires that support for fine motor or visual motor, then an OT would be involved, or sensory, but probably with OI, you're looking more at the motor